The Body Keeps the Score is a book written by psychiatrist Bessel van der Kolk that explores the effects of trauma on the mind and body, and the various approaches that can help individuals heal from traumatic experiences. Here are some important points from the book. Trauma is not just a psychological experience but a physiological one. Traumatic experiences can create changes in the brain and body that can have lasting effects on a person's mental and physical health. Trauma is more common than we think. Many people have experienced traumatic events, such as abuse, neglect, violence, or accidents, and these experiences can have significant impacts on their lives. Trauma can manifest in a variety of ways. Some common symptoms of trauma include anxiety, depression, flashbacks, dissociation, and physical symptoms such as chronic pain and illness. Traditional talk therapy may not be effective for treating trauma. Approaches such as cognitive behavioral therapy, exposure therapy, and eye movement desensitization and reprocessing, EMDR, can be effective, but many people may benefit from additional approaches that address the body's physiological response to trauma. Body-centered therapies can be helpful in treating trauma. These therapies focus on helping individuals to connect with their bodies and release tension, such as yoga, mindfulness, and somatic experiencing. Self-care is essential for healing from trauma. Activities such as exercise, healthy eating, and creative expression can help individuals to regulate their emotions and reduce stress. Healing from trauma is a process. It can take time and patience, and individuals may experience setbacks along the way. However, with the right support and resources, it is possible to heal and move forward from traumatic experiences. Trauma can impact children differently than adults. Traumatic experiences during childhood can have a significant impact on the development of the brain and can lead to a range of psychological and physical health issues later in life. The way society responds to trauma can have an impact on individuals and communities. Van der Kolk argues that a culture that prioritizes individualism and suppresses emotions can make it difficult for individuals to heal from trauma, and that social change is necessary to address the root causes of trauma. There is hope for healing from trauma. While trauma can have a significant impact on a person's life, it is possible to overcome the effects of trauma and lead a fulfilling life. With the right support, resources, and approach, individuals can learn to manage their symptoms and move forward from traumatic experiences. Trauma is not a life sentence. Van der Kolk emphasizes that while the effects of trauma can be long-lasting, they do not have to define a person's life. With the right interventions and support, individuals can learn to live with and manage the effects of trauma, and move forward in their lives. Trauma can impact relationships. People who have experienced trauma may have difficulty forming and maintaining close relationships, and may struggle with intimacy, trust, and communication. Self-awareness is important in healing from trauma. It is important for individuals to become aware of their own emotional and physical responses to trauma, as this can help them to better manage their symptoms and engage in effective treatments. Trauma can be intergenerational. Trauma can be passed down from one generation to the next, and the effects of trauma can impact families and communities for generations. Trauma-informed care is essential. Van der Kolk argues that it is important for all healthcare and mental health providers to have an understanding of trauma and its effects, and to approach treatment with sensitivity and compassion. The body and mind are interconnected. Van der Kolk emphasizes the importance of addressing both the physiological and psychological effects of trauma in order to promote healing and recovery. Social support is important in healing from trauma. Support from friends, family, and community can be an important part of the healing process, and can help individuals to feel understood and supported. Trauma can be transformed. While trauma can be a devastating experience, Van der Kolk emphasizes that it can also be a transformative one, leading individuals to greater self-awareness, compassion, and resilience. Trauma can have cultural and historical roots. Trauma can be experienced on an individual level, but it can also have cultural and historical roots. For example, entire communities can experience trauma from events such as war, genocide, or natural disasters. Trauma can impact the brain's reward system. Van der Kolk notes that trauma can disrupt the brain's reward system, leading individuals to seek out unhealthy coping mechanisms such as substance abuse, self-harm, or risky behavior. Trauma can impact the body's stress response system. Traumatic experiences can lead to chronic stress, which can impact the body's stress response system and lead to a range of physical health problems. Mindfulness practices can be helpful in treating trauma. Practices such as meditation and deep breathing can help individuals to become more present in the moment, reduce stress, and regulate their emotions. Trauma can impact creativity. Trauma can have a significant impact on a person's ability to engage in creative expression, and Van der Kolk argues that creative therapies such as art, music, and dance can be helpful in promoting healing and recovery. Compassion and empathy are important in treating trauma. Van der Kolk emphasizes the importance of healthcare providers and others involved in treating trauma survivors to approach their work with compassion and empathy, and to avoid re-traumatizing individuals. Trauma recovery is a journey. Healing from trauma is not a linear process, and individuals may experience ups and downs along the way. However, with the right support and resources, it is possible to move forward and lead a fulfilling life after trauma. Trauma can impact the immune system. Chronic stress resulting from trauma can lead to a weakened immune system, making individuals more vulnerable to physical illnesses. Trauma can impact sleep. Traumatic experiences can lead to sleep disturbances, including nightmares and insomnia, which can exacerbate other symptoms of trauma. Trauma can impact cognition and memory. Trauma can impact a person's ability to concentrate, make decisions, and remember important information. Trauma can impact self-esteem. Trauma can have a significant impact on a person's sense of self-worth and can lead to feelings of shame, guilt, and low self-esteem. Trauma can be treated. Van der Kolk emphasizes that trauma is treatable and that there are a range of evidence-based treatments available to help individuals manage the effects of trauma and move forward in their lives. These treatments may include talk therapy, medication, and other forms of therapy such as EMDR or somatic experiencing. Trauma-informed education is important. Van der Kolk argues that it is important for educators and other professionals who work with children to have an understanding of trauma and its effects, and to approach their work with sensitivity and compassion. Trauma can be a catalyst for personal growth. While trauma can be a difficult and painful experience, Van der Kolk notes that it can also be a catalyst for personal growth and transformation, leading individuals to a greater sense of purpose and meaning in their lives. Trauma can impact spirituality. Trauma can impact a person's sense of spirituality and can lead to existential questions and struggles. Trauma can impact sexuality. Trauma can impact a person's sexual functioning and can lead to difficulties with intimacy and sexual relationships. Trauma can impact identity. Trauma can have a significant impact on a person's sense of identity, including their sense of self and their relationship to others and the world around them. Trauma can impact executive functioning. Trauma can impact a person's ability to plan, organize, and complete tasks, as well as their ability to regulate their emotions and impulses. Trauma can impact attachment styles. Trauma can impact a person's attachment style, making it difficult for them to form and maintain healthy relationships with others. Body-based therapies can be helpful in treating trauma. Van der Kolk emphasizes the importance of body-based therapies such as yoga, massage, and acupuncture in treating trauma, as these therapies can help individuals to regulate their emotions and reconnect with their bodies. Trauma can impact belief systems. Trauma can impact a person's beliefs about themselves, others, and the world around them, and can lead to negative belief systems such as feelings of helplessness or hopelessness. Trauma can impact parenting. Van der Kolk notes that trauma can impact a person's ability to parent effectively, and that it is important for parents who have experienced trauma to seek out support and resources to help them provide the best care for their children. Trauma can impact work and career. Trauma can impact a person's ability to work and pursue a career, and may lead to difficulties with concentration, productivity, and interpersonal relationships in the workplace. Trauma can impact spirituality. Trauma can impact a person's sense of spirituality and can lead to existential questions and struggles. Trauma can impact community and social justice. Van der Kolk argues that trauma is not just an individual experience, but a social and political issue that requires a collective response. Addressing the effects of trauma on communities and promoting social justice is an important part of promoting healing and recovery for individuals who have experienced trauma. Compassion fatigue and burnout are real risks for trauma therapists. Van der Kolk notes that trauma therapists may be at risk for compassion fatigue and burnout due to the challenging nature of their work, and emphasizes the importance of self-care and support for these professionals. Trauma-informed policies and practices are necessary for creating a more just and equitable society. Van der Kolk argues that trauma-informed policies and practices, including those in healthcare, education, and criminal justice, are necessary for creating a more just and equitable society that supports the healing and recovery of individuals who have experienced trauma. Trauma can impact addiction. Trauma can be a contributing factor to addiction, and individuals who have experienced trauma may be more vulnerable to developing addiction as a coping mechanism. Trauma can impact the brain. Trauma can impact the structure and function of the brain, particularly areas related to emotion regulation and stress response. Mindfulness can be helpful in treating trauma. Van der Kolk notes that mindfulness practices, such as meditation and yoga, can be helpful in treating trauma by helping individuals to regulate their emotions and reconnect with their bodies. Trauma can impact creativity. Trauma can impact a person's ability to express themselves creatively, and can lead to a sense of disconnection from their creative impulses. Trauma can impact the ability to trust. Trauma can impact a person's ability to trust others, making it difficult for them to form and maintain healthy relationships. Trauma can impact the ability to feel pleasure. Trauma can impact a person's ability to experience pleasure and may lead to a sense of numbness or disconnection from positive emotions. Trauma can impact the ability to feel safe. Trauma can impact a person's sense of safety and may lead to a persistent sense of fear and hypervigilance. Trauma can impact the ability to feel emotions. Trauma can impact a person's ability to identify and express emotions, and may lead to a sense of emotional numbness or detachment. Trauma can impact social engagement. Trauma can impact a person's ability to engage socially, making it difficult for them to connect with others and form meaningful relationships. Trauma can impact the ability to regulate emotions. Trauma can impact a person's ability to regulate their emotions, leading to difficulties with emotional dysregulation and mood disorders. Trauma can impact physical health. Trauma can have physical health consequences, such as chronic pain, gastrointestinal issues, and autoimmune disorders. Trauma can impact sleep. Trauma can impact a person's ability to sleep, leading to difficulties with insomnia, nightmares, and other sleep disturbances. Trauma can impact memory. Trauma can impact a person's memory, leading to difficulties with recalling traumatic events or forming new memories. Trauma can impact sense of self. Trauma can impact a person's sense of self, leading to a sense of fragmentation or disconnection from one's own identity. Trauma can impact sexuality. Trauma can impact a person's sexuality, leading to difficulties with intimacy and sexual functioning. Trauma can impact identity development. Trauma can impact a person's development of identity, particularly in adolescence and young adulthood, and may lead to a sense of confusion or disconnection from one's own identity. Trauma can impact cultural identity. Trauma can impact a person's sense of cultural identity and belonging, particularly for individuals from marginalized communities who have experienced systemic trauma. Trauma can impact spiritual beliefs. Trauma can impact a person's spiritual beliefs and may lead to a sense of disconnection from one's own spirituality or religious beliefs. Trauma can impact the body's stress response. Trauma can impact the body's stress response, leading to an overactive or dysregulated stress response system that may contribute to chronic stress and physical health issues. Trauma can impact generational patterns. Trauma can impact generational patterns within families and communities, leading to intergenerational trauma that may be passed down through generations. Trauma can be treated through a variety of approaches. Van der Kolk discusses a range of therapeutic approaches that have been shown to be effective in treating trauma, including cognitive behavioral therapy, mindfulness-based approaches, somatic therapy, and eye movement desensitization and reprocessing, EMDR. Trauma-informed care is important in all areas of life. Van der Kolk emphasizes the importance of trauma-informed care in all areas of life, from healthcare to education to criminal justice systems. Trauma can be healed. While trauma can have lasting impacts, Van der Kolk emphasizes that healing is possible, and individuals can learn to live fulfilling lives despite their traumatic experiences. Self-care is crucial in healing from trauma. Van der Kolk emphasizes the importance of self-care in healing from trauma, including activities such as exercise, yoga, meditation, and spending time in nature. Connection is key in healing from trauma. Van der Kolk emphasizes the importance of connection in healing from trauma, including connection with supportive individuals and connection with one's own body and emotions. Social justice is important in addressing trauma. Van der Kolk emphasizes the importance of social justice in addressing trauma, particularly for individuals from marginalized communities who may have experienced systemic trauma. Trauma can be a catalyst for growth. While trauma can be devastating, Van der Kolk also emphasizes that it can be a catalyst for growth and transformation, and individuals can learn to develop resilience and live fulfilling lives despite their traumatic experiences. Trauma can impact the way individuals perceive the world. Van der Kolk discusses how trauma can impact the way individuals perceive the world, leading to a sense of disconnection and a distorted sense of reality. Trauma can impact spirituality. Van der Kolk notes that trauma can impact an individual's spirituality and sense of connection to a higher power or sense of purpose. Childhood trauma can impact brain development. Van der Kolk discusses how childhood trauma can impact brain development and contribute to difficulties with emotion regulation and social engagement later in life. Attachment patterns can be impacted by trauma. Trauma can impact attachment patterns, leading to difficulties with forming and maintaining healthy relationships. Trauma can impact the way individuals cope with stress. Van der Kolk notes that trauma can impact the way individuals cope with stress, leading to maladaptive coping strategies such as substance abuse and self-harm. Trauma can impact the way individuals relate to their bodies. Trauma can impact the way individuals relate to their bodies, leading to a sense of disconnection or even disgust with their own physical selves. Trauma can impact the way individuals relate to others. Trauma can impact the way individuals relate to others, leading to difficulties with trust, intimacy, and social engagement. Trauma can be complex and multifaceted. Van der Kolk emphasizes that trauma can be complex and multifaceted, and each individual's experience of trauma is unique. Trauma can impact the way individuals perceive time. Trauma can impact the way individuals perceive time, leading to a sense of timelessness or feeling stuck in the past. Trauma can impact identity integration. Trauma can impact identity integration, leading to a sense of fragmentation or disconnection from one's own sense of self. Trauma can impact the way individuals experience emotions. Trauma can impact the way individuals experience emotions, leading to difficulties with emotional regulation and expression. Trauma can impact self-worth. Trauma can impact self-worth, leading to a sense of shame or low self-esteem. Trauma can impact memory. Van der Kolk discusses how trauma can impact memory, leading to fragmented and disorganized memories, as well as difficulties with recalling and processing traumatic experiences. Trauma can impact physical health. Trauma can impact physical health, leading to a range of physical symptoms such as chronic pain, fatigue, and autoimmune disorders. Trauma can impact sleep. Trauma can impact sleep, leading to difficulties with falling or staying asleep, as well as nightmares and night terrors. Trauma can impact cognitive functioning. Trauma can impact cognitive functioning, leading to difficulties with attention, memory, and executive functioning. Trauma can impact interpersonal relationships. Trauma can impact interpersonal relationships, leading to difficulties with trust, communication, and intimacy. Trauma can impact addiction. Trauma can increase the risk of developing addiction, as individuals may turn to substances or other addictive behaviors as a way of coping with the effects of trauma. Trauma can impact the nervous system. Trauma can impact the nervous system, leading to dysregulation of the autonomic nervous system and difficulties with regulating emotional arousal. Trauma can impact sexuality. Trauma can impact sexuality, leading to difficulties with sexual function, intimacy, and a sense of safety during sexual experiences. Trauma can impact spirituality. Trauma can impact spirituality, leading to difficulties with feeling connected to a higher power or finding a sense of purpose in life. Trauma can impact cultural identity. Trauma can impact cultural identity, particularly for individuals from marginalized communities who may have experienced systemic trauma related to their cultural identity. Trauma can impact occupational functioning. Trauma can impact occupational functioning, leading to difficulties with maintaining employment, staying focused at work, and pursuing career goals.